Welcome back here. So May is Skin Cancer Awareness Month, something we all need to be thinking about, and a great reminder, get those annual checkups. We have Dr. Jorge Garcia from Apex Skincare to help us to really make sure we're navigating this the right way. I mean, when you hear the statistics, Dr. Garcia, 1 in 5 people will get skin cancer in their lifetime. I mean, that's something we really need to be paying attention to.
Absolutely. Thank you for having me.
It's our pleasure.
Yeah, 1 in 5 will get skin cancer. I always tell people, it's important to get checked. Be vigilant about your skin. We're all indoors with COVID, but we're gonna have growth in our skin. So make sure you get something that's popping up or something that's changing. Get it checked because it's important to get it early.
I think you think, skin cancer is maybe not as bad as other types of cancers you can get, but there are some types of skin cancer that if you let that go, you could be in some serious trouble.
I agree. Listen, there's 3 big cancers, right? The melanoma, which can be very deadly, can happen to anybody, no matter your skin type. There's basal cell and squamous cell, and luckily for dermatology, we can treat them early and 99% cure rate. But the key thing is early detection. And like I was telling you earlier, with COVID, a lot of people have delayed their screenings for any cancer. So I'm encouraging everybody to say, hey, be proactive about your skin. The vaccines are out. It's safe to go to the doctor, but don't delay it.
So once, they come to you, they find out they have some type of skin cancer, how is it then removed? What's the process?
So there's different options. We treat an individual approach to the patient. You either have surgical options or non-surgical options. The best treatment is the most surgery, which is basically 99% cure rate. It's something that we do in our office constantly every day, and it will give you the highest cure rate. There are other treatments for people that may not be surgical candidates. Like we can use creams, we can use photodynamic therapy or blue light. There's a little bit of scraping and burning, we call it. So there's various treatments of skin cancer, but it really depends on the location, the type of cancer, and really the condition of the patient, because we want to make sure we always give you the best type of cure rate so that you can continue your life.
You brought up something, and you were saying how that you are doing this every day. Your officers are seeing this every day. It's an unfortunate thing, but when you're dealing with cancers, it's important, I think, for people to go somewhere like that, where you're dealing with people who see these things and take care of them on a daily basis. They do it often.
Absolutely. I always tell people, when you're talking about the cancer word, you got to make sure you have a terrific team behind you that's going to take you and go through that journey with you. At Apex, Dr. Killian and I have done over 50,000 of these surgeries, and we're very equipped. We focus on the patient, and I always tell people, listen, you want a surgeon that really knows what they're doing to take care of your cancer? Well, that's Dr. Killian and I at Apex for sure.
So I know, again, we brought up there are several different types of skin cancer. Let's go through, the most common, and I know we have some full screens, I believe, too. Just, what should we be looking for?
Yes, so we always say anything that's changing, crusting, changing in color, painful should be checked. We have things called A, B, C, D, E of melanoma. A is asymmetry, B is irregular borders, C is different colors, D is diameter, anything bigger than a pencil eraser should be checked, and E is evolving, basically anything that's changing on you. So, check your skin, especially sun-exposed areas, and if you get something like that, get it checked, because, it's very easy to do a skin biopsy to rule out something that could be easily treated.
What about the face? I know, oh gosh, our face, it's what everybody is seeing, but when you deal with skin cancer on the face, do you have to handle that differently than you would other parts of the body?
Yeah, with the face, we've got to be conservative. So, that's what we utilize the most micrographic surgery procedure, where we take little tiny layers of the skin, bit by bit, and we check it in our lab, in our office. So the process is very patient-friendly. The patient comes in the office with cancer, lives out of there without cancer. Very powerful to see that transformation in our patient. And I tell you, that's why our patients are patients for life, because we form a really good bond with the patient. When they come in and you cure their cancer, this is something that's my passion. So It makes my day, and it's a great feeling to take care of patients with cancer.
Should everybody, no matter who they are, no matter what skin type they have, should they do yearly checks?
Once a year. I always tell people, everybody, on your birthday, check your birthday suit. So once a year, get checked. And May is Skin Cancer Awareness Month. So, use this month to check your skin. And if you find something weird or something that's changing, hey, give us a call. Go see your dermatologist. Be proactive.
And you have how many locations, again, where people can go to and make sure their skin's looking A-okay?
we have 10 locations throughout Northeast Ohio. We give same-day appointments, so no excuse. Don't blame COVID anymore. We got masks. We're vaccinated. Take advantage of our procedures and come see us if you need to.
Dr. Jorge Garcia joining us again from Apex Skin. Thank you so much for joining us this morning and reminding us all we got to take care of ourselves. You have a wonderful day.
Thank you. Have a good day. Thank you.
All right, David.
Same-day treatment, you don't see that very often, so that is really a good thing.